Hello, everyone, and welcome back to our series on high blood pressure. So far, we've talked about how you know if your blood pressure is high. We've talked about why it fluctuates, whether it's possible to reduce or even stop medications. So if you haven't already learned about all those things, you can go back to our episodes this month and, go back and start to look at the previous episodes. Okay, but today, we're going to talk about science-backed strategies that can really make a difference, whether you want to prevent high blood pressure, whether you want to reduce medication, whether you want to use supplements, or simply take better control of your health. So if you're wondering about any of these things, go ahead and keep listening. But before we get into it, I'm Dr. Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugarland, Texas. And you are listening to Connecting the Dots with Dr. Ashaye, which is a great place to be if you want to take charge of your health and keep doing what you love. All right. So also, if you haven't already, subscribe, share, like. That's how we get this information to those that need it. And that's how it helps us keep bringing you easy tips to improve your wellness and feel your best. So let's get into it. All right. So why is it important to control your blood pressure? So we talked about this in the first episode, which was about 4 weeks ago now. The thing about high blood pressure is it's not just the blood pressure, is that it puts significant strain on your body. Unfortunately, it doesn't, well, fortunately, I guess, and unfortunately, it doesn't cause many symptoms. Sometimes, it's good when it causes symptoms because at least you know something is going on, right? But with high blood pressure, the problem is most people feel fine until they're in heart failure or they have kidney damage or their eyes don't, they have blurry vision because there's damage to their vessels or they have a stroke or, they develop dementia later in life. So understanding that blood pressure is not something you should ignore. When it's high, it needs to be managed because it can cause a lot of problems. Okay, so I'm going to talk about natural ways to lower your blood pressure so we can protect your heart, your kidneys, your brain, and your overall health. So the first thing is understanding that food is medicine. What we eat really affects our health and has a powerful effect on our blood pressure. And so the things you can eat that it helps your blood pressure are a plant-based diet, especially plant-predominant diet. So if you do mostly plants in your diet, you can lower your blood pressure in weeks. Yes, weeks. So increasing your vegetables, eating fruits, whole grains, nuts, and seeds will really improve your blood pressure. It does take discipline. It's not easy, I know, but if you are really determined that you want to lower your blood pressure in a natural way, if you want to do that, you can. And that is by deciding that food is going to be your new medicine and you eat like food is your medicine. So you take your medicine every day, your vegetables, your whole grains, your fruits, and that can really make a difference. The other thing that would make a difference is your sodium. So we talked about this last time. Most sodium does not come from salt. It comes from processed foods, packaged foods. So canned foods, foods in boxes, food from out, from going to restaurants, processed foods. So the more you can cut down on things like that, the better off. So you're aiming for about 1,500 milligrams of sodium daily, which is about 3/4 of a teaspoon. So by reducing your sodium intake to that amount, you can reduce your blood pressure by 5 to 6 points. Remember that even small amounts of sodium can make a big impact in some people. So just being aware of that. There are certain foods that actually help your blood vessels relax, and so they lower your blood pressure. And those are foods that are rich in potassium. So things like bananas, sweet potatoes, spinach, beans, avocados, those are good foods that you can incorporate in your diet so that you can lower your blood pressure. And getting enough potassium can lower your blood pressure by about 4 points. So if you combine lowering your sodium, increasing your potassium, you get almost 9 points in lowering your blood pressure, which is pretty much a medication. So lowering your blood pressure with food is very possible. There are some foods that have been associated with lowering your blood pressure. Things like flaxseed can lower your blood pressure 1 tablespoon daily. Celery has compounds that can relax your blood vessels. Garlic can naturally dilate your blood vessels and improve your blood flow. And then hibiscus tea, which some people know as zobo, can act as a medication called an ACE inhibitor. It acts similar to some blood pressure medication that can lower your blood pressure. So food is medicine. You can use food as medicine to lower your blood pressure. Okay, the next tip is movement. So all of us know that, physical activity or exercise is very helpful in general for health. However, I think a lot of times we get stuck because we think we need to do a lot of exercise for it to count. But really, 90 minutes to 150 minutes of aerobic exercise a week is all you need. So it could be walking, jogging, dancing, cycling, swimming, whatever you enjoy. The thing about exercise is try to make it enjoyable. That could be by listening to something while you're exercising, like a book or music. That could be by engaging friends while you're exercising. It could be by, just do something. Make sure you're engaging in an activity that will make it fun for you so that you can be consistent with it. And you can break up your regimen. It doesn't have to be an hour every day. You can do 10 minutes a day, and you can do 10 minutes twice a day. Do whatever works for you so that you can be consistent with it. By doing that, you can lower your blood pressure 5 to 8 points. So really pretty much taking a medication. Also, strength training can be really helpful in general for your health. So even if you are, bodybuilding to an extent, be careful with that. Don't start off too heavy. You can injure yourself. Lifting weights, light weights, even resistance bands can help. But strength training 2 to 3 times a week can also be very helpful. But even things like, just gardening, that counts too. Or like I said, dancing. It doesn't have to be, going to the gym and running on the treadmill. You can find things that are active that you like doing and do them consistently and frequently, and that can make a difference. All right, the third thing I'm going to talk about is stress and anxiety. This is very important, and a lot of times we are not very good at handling stress, and we allow our bodies to become stressed, and those effects last much longer than the stressor itself. So when we're stressed, our bodies release hormones like adrenaline, and those cause our blood vessels to kind of get smaller, to constrict, and that increases our blood pressure. So really learning how to manage stress is so important. It's not just something that can be ignored. It truly does affect our health. So even things like deep breathing can really help because it lowers our heart rate and it relaxes our blood vessels. And doing it for about 5 minutes to 10 minutes a day can make a big difference. Getting good sleep is so important as well, 7 to 9 hours. And we've talked about sleep a lot on this channel. So if you have any questions about sleep, you can look at any of our previous videos. Also remember, if you have a sleep condition, especially if you have sleep apnea, that can really affect your blood pressure. So addressing that is important. Okay. Another thing we want to talk about is, or want to make sure that we look into is the impact of things like alcohol and caffeine. So drinks can really affect blood pressure, and caffeine increases blood pressure. So if you're sensitive to caffeine and then you're taking a cold medication on top of that, and then you take alcohol to help your symptoms, you're really, really going to affect your blood pressure. So just being careful when you are taking things like that, especially if you already have high blood pressure. So try cutting back, try limiting, your exposure to things like caffeine and alcohol if you do have high blood pressure. And then lastly, there are many things, that we talked about lowering your weight as well, which can obviously impact your blood pressure, but not everybody, because blood pressure is also partly genetic. And some people, lower their weight and their blood pressure does not go down with just that. So knowing what works for you is important. But then there are supplements that can help. So supplements can help support blood pressure. A lot of times you cannot supplement your way to health, to being healthy. A lot of people, would have chronic conditions and then maybe they've had long-standing diabetes or long-standing high blood pressure, and they're like, hey doc, what supplement can I take now? That's not how it works. A lot of times, we will have to be proactive with our health early on to get the best results. Because once organ damage has already happened, it's usually more difficult to reverse chronic conditions. But there are some supplements that can support blood pressure, and especially when used early on or when used, properly, especially with lifestyle changes, it can make a difference. So magnesium can help relax blood vessels, which will lower the blood pressure. CoQ10 can help support heart health. Omega-3s reduces inflammation and supports circulation. And then I talked about hibiscus and beetroot supplements can also be helpful. So for more details about supplements and how to choose high quality supplements to lower blood pressure, you can check out the link in the caption, and we will be able to send you that handout that we have. And on that, I also share my favorite brands of supplements. But remember, don't just start taking supplements. For instance, beetroot can increase your risk for kidney stones. So you need to be careful when taking supplements. You want to always check with your doctor before you start taking anything. All right. So you can take control of your blood pressure, and it is possible to lower your dependence on medication. It's possible to naturally lower blood pressure. To do that, you would want to eat more plant-based foods, more whole foods. You will want to reduce sodium. You want to increase your potassium. You want to exercise regularly. You want to manage stress and sleep well. You want to cut back on alcohol and caffeine. You want to try to be at a healthy weight. So remember, every little small change you do adds up. And you want to work with your doctor. If you don't have a doctor already and you're in the Houston area, or in Texas and you want to work with us, you can contact us with the information on the screen or in the caption. So I hope this series has helped you understand high blood pressure better. And if you found it valuable, please be sure to like, subscribe, share this video with someone who might need it. It really can make a big difference for them. Thanks for watching, and I'll see you next time.